Okay, Dr. Fazai and Dr. Maunze and many others. So I think now we can go on to the scoring. So I'm going to give you, do you want me to give you the scores first, or do you want to share your scores before we give you how we rate the scoring? Dr. Fairchild Amuna Kwadi. Okay. All right. Okay. Silas wants us to give the scores first. It's all right, Dr. Silas. Okay. So if you scored 9 and below, I'm not too worried about you. I think you are on the right track. But if you scored 10 and above, you need to be a bit more conscientious in terms of your mental health self-care. All right. So those who scored 10 and above, please let us be more conscientious and more intentional in terms of helping ourselves. And then what self-help techniques are we going to be talking about? We're going to be starting with the very simplest of things, the very, very simplest of things. Somebody mentioned in the chat box that as a lady, some of the challenges they face is juggling family, kids, and work. And I feel that you are going to benefit from time management techniques, which we have always known about. They are not new, but we remind each other so that if we had not been implementing any, we start doing so. So the first is prioritizing tasks. So you find that sometimes you feel as if you are needed in 3 different places at the same time. Maybe you are needed at work, maybe you are needed for a CME like this one. I know that some people are still driving. They want to get everything done. They want to drive home from work. They want to earn a CPD point, and they want to do homework with their kids. So you find that amongst us, amongst the 51 who are participants, some are not even really listening. That may be the reason why after I call out somebody's name, they don't respond, because they are just present with what we call presentism. Being physically present, but emotionally and mentally not present. So when we learn to prioritize, then we can do the things that we need to do, and we can do it more efficiently. So in order to help us to prioritize using calendars and planners, that's really important. And in our planners, our calendars, we also need to include, if in family functions, if in time for relaxation, time for tennis, time for swimming, time for prayer, time for work, time for homework, time for your kids' consultations. All right. And then it's also important for us to learn to delegate. I know that one of the traits amongst the dental professionals is that they take pride in their work. They want to be that person who did those dentures perfectly, that person who put on those braces perfectly, that person who put on that filling and saved the tooth perfectly. All right. But sometimes you find that if you are very exacting on yourself, you tend to do so much by yourself. You tend to do your bookings. You tend by yourself. You also tend to work with the clients by yourself, and to do so many other things by yourself. So we should learn the art of delegation. Can we trust our staff? and delegate to them. And if for any reason you feel that your staff is not ready to have things delegated to them, it may also be time for you to consider somebody who's capable of doing that, so that you benefit from having somebody working with you who can take the pressure off of you. And then the other thing we need to do is to minimize distractions. So the first thing in minimizing distractions that I would say is your desk. How tidy or untidy your desk and workspace is, it reflects emotionally and mentally how well you are doing. When you walk into a room or your workspace and you find that it's orderly, already the fact that you are seeing things in order, it puts you in that mode to be receptive and able to deliver your job efficiently. However, when you come to a desk that is untidy, already because you are having a hard time finding your prescription scripts, finding your rubber stamps, finding your other important things, you find that even the simple tasks ahead of you, they now become very, very difficult. So in terms of minimizing distractions, I will ask, how many of us have neat and orderly desks? How many of us know exactly where we keep this thing, so that we don't spend time looking for things instead of doing things? Okay. And then the other thing, we need to have set times for social media. I know these days our social media is just in our pocket, and one can be tempted, like after you have put an analgesia, local anesthetic, on your patient, maybe before a tooth extraction or before a filling, you find that in that 5 minutes you are on the social media being bombarded with what's happening on WhatsApp, Twitter, and so forth. It creates this sense of being very, very overwhelmed, so that by the time you go to your difficult patient, it's as if nothing in the world is okay. So we actually need to minimize those social media distractions, and we need to have set times for looking at our phones and to be able to stick to it. And then it's also important to take breaks. I know that some of us, maybe especially those who are in the private sector, they are afraid of taking breaks because they feel that money can just go away. I mean, the doctor is busy, they are having tea, and a patient is waiting. So you may find that in a day, particularly during busy periods, could be month end or that time of the month when people have a lot of money, or during the tobacco selling season, you find that many people may not be taking enough breaks, and that may be putting pressure on their mental health. Okay. And then exercise. I'm going to ask a question just for us to ask ourselves and reflect. How many of us are exercising every day, or at least 5 times a week? And when I'm talking of exercise, I know that dental work can be physically demanding, spending long hours standing, straining your back, your neck, your shoulders, and so forth, but that's not exercise. I know many people who say, I dig a garden, so I exercise. But that's not the exercise I'm talking about. Exercise which has been found to be mentally beneficial is that which we call intentional exercise. So we are talking about putting aside specific minutes or hours a day of exercising. When we are intentionally putting our minds towards exercise, and then doing the exercise for at least 30 minutes on those days, you then find that it helps, your body releases endorphins, which then boosts up your dopamine, which is the feel-good hormone, which then relaxes those tense muscles, those tense necks, and then which also gives you a general sense of well-being. I can see a hand. I don't know, is this a hand from before, or it's a hand for where we are right now? Okay, I will assume silence means it's a hand from before. And then it's also important during those mini breaks that you take for you to do some form of exercises, mini exercises, stretching your muscles, stretching your necks, your backs, etc., so that your body gets to realign and to release some tension, and then you can become more efficient. Okay. And then the next thing we're going to talk about is having manageable goals. So the first goal, the first thing I will talk about is your own expectations of yourself. Most of the time, our pressures, they come from ourselves, what we expect of ourselves, where we think we should be by a certain period in your life. Like, oh, I've been working for 5 years. How come I don't have this thing? How come I'm not where others are, you know? So those internal expectations need to be managed. And we need to learn to be realistic with our goals. Remember, maybe a person who started practicing 20 years ago, we were in a better era in terms of Zim US dollars, I'm not sure, versus a person who started their practice maybe 2-3 years ago, and who right now thinks that they should have been set for life. And yet, as somebody said, the ZiDA things and the water cards and all of those things, they're impacting progress. So we need to be realistic. We need to time and again realign our goals with realistic things. And then it's also important to seek support and mentorship. And I will ask maybe a rhetorical question. I would like to believe that all of you, none of you are still students. All of you have done your first qualification, be it a degree or a diploma. And I would like to ask, how many of you still have mentors? So sometimes we tend to think that after graduation, you don't need a mentor, you can try it on your own. But the world out there is really big, and you can get lost trying to find yourself. And it's important to get somebody who will root you and support you and help you to align your goals realistically. So if amongst us we don't have mentors, I am encouraging you to find a mentor. All right. And then developing healthy routines. Here I will say, I want to give one of the reasons why mental health challenges increased drastically during the COVID era. The reason was that there were losses of routines. You have a child who was used to waking up at 6, bathing by 7, eating by 7:30, school by 8, after school activities by 4:30, home for homework by 5, asleep by 8. Now with COVID, people were home 100% of the time. There was no school. So people were given homeworks, which sometimes would be done at midnight instead of somebody sleeping. People would do school during odd hours, all right? So there was a loss of routine, which also precipitated mental illnesses. So your mind and your body, they need routines. And these routines are the habits that we set for ourselves. So it's important that when you're designing a routine, you need to include the important things that you sort of do every day to keep yourself sane. I hope you understand. And this can all be summarized in what we call a work-life balance. If life is all work, or life is all life, you know, all parties, then the loss of that balance can destabilize us emotionally and also negatively affect our efficiency at the workplace. So it's important to set those routines and to set boundaries. When we are talking of boundaries, we mean when you are home, you are home. You are not at work on the emails or bringing home stuff from work. You need to set boundaries. And then you need to prioritize self-care. You need to learn to say no. Amongst us, some of us, we may still be working with colleagues. Some of us work in solitude. Learning to say no is not just about the professional space, but it's also about family engagements. You know that you now deserve, you need a weekend's rest. And everyone is saying, oh, please come to Maroro, Apita, please come to this and that. But you know you really need to take time off for yourself. So you need to learn to say no, okay? One example I always give people is for those who've been on the planes before, we've been taught that before you help anybody else to put on their oxygen mask, please make sure that you put on your own mask first. So by so doing, we are saying, if you don't prioritize yourself and you prioritize others before yourself, chances are you will suffocate before you manage to help A, B, and C. So it's important for you to put on your oxygen mask and be safe. That way you are more efficient. You can save more lives for A, B, C, and D. So when we don't say no, we are sacrificing ourselves, but also not being efficient in the roles or the tasks to which we have said yes to. And then I'm back. All right, I'm back. I'm sorry about that, everybody. There's no ZiDA here, so sometimes my network is letting me down. But that was my last slide. I'm going to invite feedback and questions. All right. I'm going to invite feedback and questions from all of us, from any of us. If there are no questions, I'll pass to do one relaxation technique. Okay. I hope you can hear me. My internet is unstable. Okay, thank you, Dr. Mungani. I can see your comment. Okay, so I'm going to try to help us to do this one relaxation technique. I don't know how to enlarge my video. How do I do that? Okay, forgive the poor picture quality. Okay, so I hope we can all see me, and I hope we're going to be participants rather than spectators. So I would want us to clasp our hands like this. Okay, I hope we are doing it. Can you also put on your videos so that I see that we have an interactive audience? Thank you, Sana. Hey. Okay. Only the dog Sana is there. Oh my goodness. Don't tell me, dental professionals. And Tashinga, thank you. And Marvelous, Nasser, Ismail, Fiona. Awesome. At least I know that I have people I can see. All right. So I want us to clasp our hands like this. Okay. I'm waiting for Dr. Fiona. Yeah, yes. Now I want you to pull very hard, as if you are pulling at your shoulder blades, as if you want to pluck your shoulder blades out of you. And I'm going to count. Pull very, very hard. 1, 2, pull harder. 3, 4, harder. 5, 6, harder. 7, 8, 9, and 10. Now I want you to let go slowly, 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 and slowly. I want us to feel the flow of energy from our shoulders down through our arms, our hands, out through our fingers. Okay, did you feel that? Or should we try it again now that you know? Can we try it one more time? All right, so clasp your hands like this and pull. Okay, very, very hard. I want you to feel your shoulders as if you are pulling them, counting 1, 2, 3, 4, 5, 6, pull harder, 7, 8, 9, and 10. Now slowly, let go. Feel the tension moving from your shoulders and down through your fingers. Okay, did anyone experience a form of relaxation? Oh, you didn't? Oh, my audience is very quiet. Guys, let's talk, let's discuss.
I did, thank you.
Thank you, Fiona. So this is just one of the examples of how to help yourself relax. So I want us to note that this is something that you can do in the office. It doesn't require huge amounts of space. It just requires you to be on your chair. Even in the bathroom, you can use those techniques for yourself. All right. And then as homework, I want us to go and read on some breathing techniques that you can employ to calm your nerves down when you are having a hectic and busy day. Otherwise, thank you all. I hand over to the chair. All right.
Thank you, Doc.
Thank you very much, Doc. I think the chair has fallen off. Dr. Chingwena, can you help close for us?
Good evening, colleagues. Thank you very much, Dr. Chinoperekwei, for helping us on this session. It's been very informative. I hope the whole series has opened a few questions that colleagues will begin to explore more. Otherwise, the whole point is let's look after ourselves first. I think with that, just to thank everyone who managed to join in the call, we can put the meeting to a close. Good night.
Thank you. Good night, everybody. And thank you for having me.
Thank you, good night.